Okay, my name is Art Goldhammer. It's my pleasure to welcome you to this special seminar presented by the Mindy de Gunsberg Center for European Studies. This will be a review of COVID-19 responses across Europe. The presentations will be made by a select group of our visiting scholars this year. It's our pleasure to welcome them back to the center virtually. They've scattered all across the world. We're also pleased to have close to 200 participants in this seminar, so far the largest and most diverse group that the center has assembled since the onset of the crisis. So welcome everyone, and we hope to have a very good and lively discussion. The presentations here will eventually find their way into a publication which is being coordinated by Barry Kolfer, one of our visiting scholars and one of the presenters who has been the dynamic force behind this session. We're going to proceed in the following way. The presenters, we have 10 presenters. They're divided into two groups of 5. Each one will be given 3 minutes to present. I will be timing them ruthlessly. At the end of the first group of 5, we'll pause for some questions which have been pre-submitted by members of our audience. And we'll then continue with the second group of 5 and another set of questions. If there's time at the end, we're delighted to have a commentary by Dr. Hartmut Meyer, who is the head of the Center for European Studies at Oxford. Our first presenter, I'm going to ask you, I'm not going to make formal introductions. I'm going to ask each presenter to state his or her name and affiliation, and we'll dispense with any more formal introduction than that. Our first presenter today is Sebastian Royo. So Sebastian, the floor is yours.
Thank you very much, Art. Good morning, everyone. I'm Sebastian Royo. I'm the professor of government at Suffolk University here in Boston and a visiting scholar at the center. Michael, if you can put the slides on. I'm going to be presenting about the case of Spain. And I just wanted to explain a little bit what has happened in Spain, the responses, and some final thoughts. So in the case of Spain, I think it's been one of the countries that have been the most affected by the COVID-19 crisis. Next slide. As you can see, Spain has one of the largest numbers of deaths, number of confirmed cases, and also the second highest death rate of the people who were infected with the virus. So it has been really devastating for the country. Next slide. From an economic standpoint, Spain was about recovering from the 2008 crisis, and the economic consequences have been already devastating. By mid-April, over 800,000 people had lost their jobs in the country, and the government is forecasting that the economy will contract almost by over 9%, and unemployment will reach 19%. But these are considered somewhat optimistic forecasts. There are other people that estimate that the economy will contract over 15%, and that unemployment will be over 20%. This happens in a context in which the Spanish economy has significant structural and historical vulnerabilities that have made the economy suffer more than other countries. Next slide. Now, in terms of response, the government acted to contain the virus with a series of steps, including one of the most stringent lockdowns in the world that has been in place through the end of last month. From an economic standpoint, they put together a series of fiscal packages and measures that were the equivalent of about 12% of gross domestic product, which is a figure that is relatively low compared to other European countries, including social measures to support people who have lost their jobs and also businesses. Next slide. Now, in terms of the reasons, why is it that the crisis has been so devastating to Spain? Some of the reasons are of a structural nature, like the fact that the Spanish population over 65-year-old is about 19%, which again is not too high for European standards, but it's significant, and they were very vulnerable. Spain is a country also of very high traffic. Even in the weeks and months prior to the crisis, when the virus was circulating, we had thousands of tourists and people arriving into Spain. We also have a healthcare system that had been significantly weakened by the financial crisis of 2008. I think the most important factor was the lack of preparation and the delayed response. Like many other countries, the government underestimated how bad the country was going to be affected. And I think this was truly devastating for the country. Then there are a series of political...
You're at 3 minutes, so take 1 more minute to finish up, please.
Okay. Other political factors that I think that have affected the performance of the country. Next slide. Just very quickly to conclude, Spain again has been one of the most affected countries, but it's important to emphasize that it is too early to tell the whole story. It might well be that because it has one of the largest cases of infected people, that the country has herd immunity, and in the long term, it might be better off. I think just to conclude, it's been remarkable to see the resilience of Spanish people and manifestations of solidarity. But on the other hand, there has been on the political side a search for scapegoats and deepening political divide that I think don't bode well for the future. Thank you very much, everyone.
Okay, thank you, Sebastian. The next speaker will be Albana Shahai, who will cover the Western Balkans.
Albana, can you unmute yourself?
Thank you. Hello, I'm going to talk about the effect of the COVID-19 crisis in the Western Balkan countries of Albania, Bosnia-Herzegovina, Kosovo, Montenegro, North Macedonia, and Serbia. So the crisis in the region has impacted all countries without a doubt. However, it has done so in different measures across them. The share of the population has been limited. The share of the population affected by the crisis has been limited primarily due to very stringent measures, cautionary measures taken by the country's governments, by the region's governments. In its initial stage, the health crisis presented a tremendous threat, not only to the health institutions of the Western Balkan countries, but also to the fiscal capacity of these countries to actually handle and counter the effects of the crisis. Recall that we are dealing with countries that, when compared to their Western counterparts, are extremely falling behind and lagging behind in terms of economic development and resources available to actually address the crisis effectively. And therefore, given the high stakes, most of the countries in the region acted very early on, rather swiftly and decisively to contain the impact of the crisis. And then there were multiple measures taken. Among the measures taken included closing borders, traveling restrictions, strict quarantine rules, especially for members of diaspora returning home, banned public gatherings, etc. Other measures included sweeping police powers, shuttering of the courts, increased surveillance, restrictions on media reports regarding the effect of the crisis and the public attitudes concerning the impact of the crisis. However, despite the stringent nature of these measures, one could argue, previous slide please, one could argue that the effect of the crisis was actually contained in the region. As you can see here, the measures were effective in controlling the spread of the virus. In several countries in the region, the number of reported cases stayed within hundreds, and that includes Albania and Montenegro. And then in other countries, it increased up to thousands of people, as was the case in Serbia, which was hit hardest by the crisis. There are several implications to this. Next slide, please. There are several implications, and they include both political and economic implications. The crisis has unveiled several latent tendencies, and they range anywhere from the scope of government authority to domestic party politics in the region, to the frequency and magnitude of popular dissent and public attitude regarding not only the impact of the immediate health crisis, but also a precedent that this crisis must establish in the future of the country's political developments. These implications also concern migration patterns and the role of diaspora, as people who have returned home, particularly in Serbia, they have not always been welcome to do so, given the risk, the health risk. However, there is one particular development and an implication deriving from this development that I would like to draw attention to, and that is the role of the EU and what that means for the fiscal and political developments of the countries in the region. Next slide, please. So the EU has been especially generous in the case of Western Balkans, and it has given it, the crisis has given it an opportunity to redeem itself. The EU had fallen behind in its credibility in the region, especially due to the latest political developments of denying any accession talks to Albania and North Macedonia. However, recently, not only that has changed, but also the fiscal packages that the EU has provided to these countries has been substantial. And as you can see, in the case of EU has invested not only short-term benefits, which was the previous slide, but also in the amount of 3.3 billion financial support package mobilized jointly with the European Investment Bank. It has also activated $38 million euros of immediate support, 389 million of social support for social and economic recovery in the immediate, short, as well as longer term. And it has.
Excuse me, Albana, you need to finish up.
Yes. So the EU has been tremendously generous in the case of the Balkan countries, and I believe that's largely has to do with the competing interests in the Balkans and the proximity of Russia and China as potential influences. But also what bears mentioning here is the impact of these unprecedented amount of resources entering these countries. What that could mean in many cases is that these countries, given the lack of transparency, as well as scoring considerably high in terms of corruption in the region, there could be a lack of accountability. And this is especially pressing now that the governments have assumed unprecedented powers, and the role of the opposition has weakened substantially in the region. I'm happy to say more about this in the Q&A, but for right now, I think those are the two major implications of the health crisis in the region. Thank you.
Okay, thank you very much. The next speaker is Zoltan Adam, who will cover Hungary. Zoltan.
Yeah. Hi, everybody. Thanks a lot for being able to hear, and thanks for organizing this talk for Barry and the center. I'm Zoltan Adam. I'm from Corvinus University of Budapest. I'm an economist and a visiting scholar at the center. And I'm going to talk about Hungary, which is, I believe, an interesting case, a case of relatively mild impact. If we can move forward with the slides. Yeah, for the next one, please. Thanks a lot. So you can see Hungary was relatively mildly affected by the crisis. This is the May 13 situation. It's pretty much in line with the general kind of Central European pattern. The crisis seems to be easing in terms of healthcare, and the country seemed to have, survived relatively well, although of course there have been considerable death and other damages. And economically, it's an interesting case, and also it's an interesting case in terms of human rights and freedom. So please go to the next slide, Michael. Thanks a lot. So Hungary is a case in which the government has assumed considerable extra powers. There's an act which is the so-called enabling act that was passed by the Hungarian parliament, and which gives essentially unlimited decree power to the government, which means that the government can govern by decree, overruling any existing acts until the government itself decides it's warranted by the crisis. And this is very problematic from a constitutional sense, and it has actually stirred considerable debates in the European Parliament already. Not just in terms of general rule of law considerations, but also in terms of civil rights. So actually, in the past days, in two separate cases, the police detained individuals for simple Facebook posts criticizing government actions. At the same time, the government wages propaganda war. The next slide, please. Here you can see Viktor Orban, the Prime Minister of Hungary, in a YouTube ad, or an ad broadcasted on the YouTube as well, in which he ensures the Hungarian citizens that no Hungarian is alone in this crisis. The next slide, please. And finally, to say a few words about the economic policy response, Hungary, again, in a kind of interesting situation of being limited in terms of fiscal capacity due to the pro-cyclical policy stance of past years. The Hungarian budget has a limited scope of taking extraordinary measures, and the government recognizes that. So it's not exactly clear, but probably not more than 1, 2, or a few % of GDP is mobilized in terms of fiscal measures as extra impetus for the economy. There's a 70% wage subsidy up to the twice of the minimum wage level. And there's a strong policy preference for domestic capital market financing as opposed to external financing. The government tries to avoid the inclusion of external capital market financing to retain a kind of economic nationalism stance. I will stop here, and I'm very happy to come back in the Q&A. Thanks a lot.
Okay, great. Thank you very much, Zoltan. The next speaker is Fritz Zager.
Yep. Hi, everybody. Michael, do you have my slides? Okay, I'm Fritz Zager. I'm from the University of Bern and also a visiting fellow at the Center for European Studies. I'm going to give you a short account of what's happening in Switzerland. And yes. Yeah. Okay, next slide. So what you got here is the curve of the R value, how it developed in Switzerland. The R value is the reproduction value of the infection. So as long as the R value is above 1, that means that if you carry the virus, then you will give it over to more than one person. So there's an exponential spread. And as you see, we have managed to lower the spread and to flatten the curve quite well. What you also see is that Switzerland was affected early. It was affected much earlier than government actually responded with measures, with public health measures. But we were informed about the virus as early as December by the World Health Organization, which is seated in Geneva. But the government responded only about in January, and it took another month because before they issued an ordinance that banned events with more than 1,000 people. But from then on, it went pretty quickly. We had our first death in March, in early March. And that was the time when they started promoting the hygiene and social behavior rules. And from March 13 on, we went to the full lockdown in the state of emergency as foreseen by the Pandemic Act that we had. So on March 13 we shut our schools, and from March 16 on, public life was shut down. But we never had the strict confinement as we had in neighboring countries. So we were still allowed to go out without having a formula allowing us to go jogging around. We were free to move, but government built on our responsibility for ourselves. So there were no hard controls. It was no full confinement, but we were asked to stay at home. As you see, that worked quite well. And so, next slide, Michael. And so in April, government started a reopening strategy. This is a very Swiss strategy. It is very stepwise, incremental, consensual. It is based on the interests of the organizations, of the labor organizations, of the business organizations, and what we have is, yeah, I'm going to stop quite soon. What we have now is the compulsory schools have reopened, restaurants have reopened because there was a huge pressure from the gastro industry, and in a month we'll have a reopening of the high schools, of vocational schools, of theaters and zoos, funny enough. So next slide, last slide. Overall, Switzerland had a very had a cautious, prudent, very much directed towards acceptance by the people strategy. We had a huge compliant, but this is a demonstration last Saturday in front of the Federal Palace, and it shows you that people started to being fed up with the measures. We have the esoterics, we have the anti-government groups, right-wing extremists, left-wing extremists, but people start being fed up with the lockdown, and so it's good that we start reopening. We are afraid of the second wave, and we suffer from the prevention paradox right now. These people say these measures were not necessary because the measures worked that well. So that's our current situation. I think Swiss government did a good job. Thanks.
Okay, thank you very much. And the next and last speaker in our first group will be Monica Bauer, who will talk about Sweden.
Hello, everyone. Thanks for joining. I'm Monica Bauer. I'm from the University of Gothenburg in Sweden, a previously visiting scholar at the CES. I'm going to talk for a couple of minutes about the Swedish strategy to combat the COVID-19 or to try to curb the pandemic. Sweden is by and large the European exception and an outlier in the sense that it's the only country that did not, or one of few countries at least, did not implement an absolute lockdown, and it has more limited restrictions on economic activities. There's of course a lot to be said about this approach, but I'm going to try to focus on three main points here. The first of them being that it's important to note that the absence of lockdown does not mean that life goes on as usual in Sweden. A lot of people are self-isolating, not least people in high risk groups, those that can work from home. Universities have online teaching, large public gatherings are prohibited, all non-essential travel is restricted, and visiting elderly home is forbidden. The second thing I want to say about this strategy is that it has been sometimes been described as relying almost entirely on social trust and voluntary measures. So rather than a punishment regulation approach, this would be an example of an individual responsibility, social trust approach. Citizens would be expected to trust other citizens to comply with government recommendation and refrain from free riding on other citizens' efforts. I think this is only partly true. I think the strategy just as much relies on the encompassing welfare states that makes it economically possible for large sections of the population to comply with recommendation, universal healthcare policies, unemployment benefits, paid sick leave policies, for instance. And I think that the importance of these policies is very much illustrated by the cases where they break down. So the elderly care is one of these sectors where Sweden has blatantly failed to protect its elderly nursing home residents, with dramatic death tolls among this poor and very vulnerable group. The third thing that I think is worth noting about the Swedish strategy is that the strategy is largely depoliticized. It's run by an independent bureaucracy, the Public Health Authority. The government is rarely seen to communicate about anything else than economic stimulus packages or occasional harsh restrictions, but most of the day-to-day communication is made by the public health authorities and with very little interference by politicians. And also another important thing to note is that the absence of lockdown has very much been motivated also with reference to the Swedish constitution. The Swedish constitution prevents a large-scale, full-scale lockdown. And I think this is very much also part of the explanation for the strategies that Sweden has elected in the face of the pandemic. I'm happy to talk more about this in the Q&A. Thanks for joining.
Thank you. Okay, so that concludes our first group of 5, and we'll pause now to take a couple of questions. I will first draw on questions that were pre-submitted by members of the audience. I've combined two which have to do with the consequences for democracy of the COVID crisis. First question is from Tracy Soberry of Oxford. How worried should we be about governments, particularly in Eastern Europe, exploiting the emergency legislation they introduced to tackle the crisis in order to enhance authoritarianism, stifle the press, reduce human rights, and so on? And then a related question from Dimitri Tsarouhas from Bilkent University and George Washington University. Has the pandemic facilitated or inhibited democratic backsliding, and why? So I invite the 5 presenters who have already presented to respond to those questions, and also the other 5 members of the panel who have not yet presented, if they wish to jump in on those questions. So who would like to go first?
I can go in first.
Albana.
Thank you. I'd like to address the question about what this means, what the health crisis, what the dangers or risks, if you will, or opportunities that the health crisis has presented for democratic developments in the region. I think the moment serves both as an opportunity, either for the worse or for the better. And I'm hoping for the better, but my fear is that it also gives an incentive to regional government, to the region governments, Eastern European governments in general. As we saw in the case of Hungary, the crisis has given this has sort of justified a politics of isolation, nationalist politics, if you will. Because if the theoretical expectation is that if we shut our borders, we are going to deter any kind of health crisis, then that can become sort of a norm later on. Combine this with the with the inherent tendencies of these countries in the Eastern European regions to actually lean towards authoritarian politics, and then you have a real danger. The opportunity for the better change in this midst is that the EU has now come closer to the Eastern European countries, as I mentioned earlier, particularly of the Western Balkan countries, and it has done so by providing fiscal resources. At the same time, it has lent this expectation that in times of crisis we will be there for you, and you are part of the larger geopolitical network. However, I think what happens from this moment on is largely contingent upon what the countries themselves do. If governments have a tendency to actually want to lean towards authoritarianism, they will do so. I'll take the case of Albania. Albania right now has absolutely no opposition in the parliament. The parliament has walked out a couple of years, more than a year ago. So what that means right now is that the government has absolute authority to implement any kind of policies, as well as engage in any type of any type of politics that they have meant to. We are hoping, and it's the case, that Albania is actually promoting democracy in this moment of crisis, but that risk exists in other countries in the region as well. In Kosovo right now, there is no opposition. In Hungary, we see that opposition is nowhere to be found. So it's at least silent. So there is a real threat to democracy, but I think it will align with previous tendencies.
Okay, thank you.
If I can jump in.
Yes, please.
I have elaborated a bit on Hungary, and I think it's a good and very, very sad case of democracy being threatened in context of the crisis. So the short answer to the question is we should be very much concerned about these developments. And it's not only about Eastern Europe, I would argue, it's also about the EU as such, how the EU is reacting to that. As I said, there is an ongoing debate in the European Parliament, and the European Commission is trying to reflect on the situation. It's obviously not easy. Poland is actually another interesting case in which a presidential election was postponed, eventually in very strange circumstances, and it was not clear how authorities would be dealing with this situation. And in general, governments in this part of the world, I would argue, are trying to use the situation for their own benefit. Obviously, civil society is also threatened, and it's in a kind of situation of inaction, a paralyzed situation. It's very difficult to mobilize against government actions. in such a situation. But the crisis will end at some point, and the question is how at that point government actions will be deemed. I think it's an open question. We don't know yet, but governments may overplay the situation, and it can be also to some extent at least damaging for them if they obviously misusing the situation. Like I said, the police detained civilian individuals in Hungary, which obviously reflects badly on the government. It's not acceptable according to social norms to detain someone for a government critical Facebook post. Thanks.
Art, if I may jump in?
Yes, please.
I think at the heart of this debate is the question of who is responsible for handling a crisis like this. I guess overall you have four kind of answers to that question. I mean, one is the individual, where it's responsible. The second one, of course, is the community. This could be a more egalitarian approach in which we are all responsible for each other and we need to protect each other. The third one is the leader, the more hierarchical approach in which we have people that make those decisions for us. And the final, of course, is nobody. We don't do anything. We just hope that it goes away. And I think what we have seen in our countries have been different degrees of in which all these approaches have been used. To a significant degree, it's true that the hierarchical one in which we have had leaders telling us what to do with the consequences that we've seen have been a common that. But we have also seen, and it has come out in some of the presentations, some of the backlash to that approach. And what I want to emphasize that it has been striking to see all over the world, everywhere, has been the increase in the egalitarian approach and the communal approach, the peer pressure that we see people to try to do the right thing and to force others to do the right thing to protect each other. So yeah, I think that you can make an interpretation that there has been a degree of democratic backsliding, but I think we should also emphasize all the instances in which we have seen the communities across the world coming together to try to do the right thing.
Yeah, add something to that. I think Hungary, Orban framed a lot of the discussion with his emergency law. In Switzerland, it was sort of a bizarre, if not ridiculous, discussion. That people were afraid that the government would seize power and not give it back, because it was actually government who reinstalled the parliament, who made the parliament seat again, to acknowledge the amounts of money that they spoken for the emergency measures. But the discussion was always like there were sitting seven little Orbans in our government, which is bizarre, but Orban definitely led the way how to perceive emergency rule and emergency measures. I think it's the most important thing is, does the Constitution have does the Constitution give you a basis for emergency law? And we had that, and the Constitution also said when to end it. So in our case, I never had any concern about the rule of law or democratic backsliding.
Let me expand on the question a bit, broaden it out, and address some of the points the several of you have just made. In the midst of this crisis, the German Constitutional Court issued a much remarked ruling challenging the authority of the Court of Justice of the European Union. And this, although this decision was not directly related to the Corona crisis or to Corona bonds, it comes in a context where Corona bonds were being discussed. And one way of looking at the effects of that decision of the Constitutional Court is that it's going to encourage countries like Poland and Hungary, which had already been challenging the authority of the central institutions of the European Union, to continue their challenges and thus call into question the way that the European Union has been trying to respond, as Albana pointed out in her response. So I wonder if any of you would like to comment on that action by the German Constitutional Court.
I mean, maybe Art, if I can comment, I think one of the largest risks of this crisis yet again is that it might deepen the divide between the North and the South in the European Union. I think that was one of the major concerns following the 2008 crisis. And if anything, the intensity and the depth of this crisis can only make that worse and make things different. So I think from that perspective, the decision by the German Constitutional Court is very, very worrisome because it hinders the ability to develop a European-wide response that is effective enough to deal with the crisis. Ultimately, it's not just an issue of solidarity, although I think that should be at the heart of any European response. Solidarity was at the end one of the cornerstones of the foundation of the European community and the European Union. But it's also an issue of law. I mean, when you think about the appropriate functioning of a single market, the fact that you have such huge disparities in the amount of aid that companies are receiving across the European Union, depending on the economic situation in each country, that's going to create distortion that will definitely have an impact on the single market. So I think that there are legal implications to that. So for this reason, I think this is a very problematic decision.
Okay, thank you. I'm going to move on to a second pair of questions. The first is from Herrick Chapman, who asks, has COVID-19 reinforced conventional modes of governance in the countries you analyze, or has it rather catalyzed changes to something new? And then related to that, from Regina Paul, a former visiting scholar at CES and currently at the University of Bielefeld. Do COVID-19 responses in your respective countries stick to well-trodden institutional paths with some updating, or is there considerable departure from normal crisis management? Would anyone like to take on those questions?
I can perhaps go first because I think it's a fairly straightforward answer in the case of Sweden, because we have been following all the well-trodden paths that we usually follow, with trying to limit any infringement on the constitution. We are not allowed to lock down, so we haven't locked down. There's not a politicization of the crisis, so the opposition has been fairly quiet in terms of criticizing the government approach. We are very much relying on our independent and depoliticized bureaucracy. So all these forms of there's a lot more than relying on social trust. It's actually a crisis management strategy that we have had in Sweden for a long time. And we are only allowed to impose restrictions on freedom of movement in times of war. And this cannot be defined as a war by the Swedish constitution. So I think in the case of Sweden, we have very much followed the well-trodden institutional path towards crisis management.
So if I can jump in here.
Yes, go ahead, Zoltan.
So I think Hungary is just the polar opposite of Sweden. It's a completely new situation in which the government actually experiments with expanding its own powers and kind of legitimizing extraordinary powers, quite consciously trying to make to create a new normal amidst the crisis. And it's a kind of competitive situation between the national government and the EU. So just referring back to the previous question, I think national governments are trying to legitimize their own actions, at least in some countries. And it's a pretty big stake whether or not we see European level institutional legitimacy to be intact or not. And in that context, I think we should be worried about the potential loss of legitimacy of the European Court of Justice as well. Thank you.
Switzerland, it was, pardon? In Switzerland, it was quite a change in the mode of government, because in Switzerland, government is highly party political, very politicized, very much participation from below, very slow. And all of a sudden, the bureaucracy took over, and that was a big change in there was a big change in government and government mode. But it was actually it turned out pretty good. They did a good job, and it was actually good for the bureaucracy to have this prominent names that were the face of the state in times of crisis. They were competent. They were quite sure in what they were doing. So I think they gained a lot in trust in government during this crisis because they were these trustworthy figures. And for the 3 weeks that there were no party politicians in the media and no parliament seating, actually no one really missed them. It's good that they're back now, but it was a crisis. It was the time of the executive and not the time of the legislature. And so we had this shift, and now we shift back, and we have the usual political, ideological quarrels.
I think, Art, if I may, I think the
Yes,
most important point of departure has been the establishment of a state of emergency and a state of alarm in many of our countries with the suspension of fundamental rights. I think that has been something to manage this crisis that has been very unprecedented with dramatic consequences for fundamental rights. I think the other dimension that I think is very important, and it will be interesting to see how it evolves, is for countries that had a significant degree of decentralization, like Spain or even the US, with federal system, the suspension of a lot of the of this decentralization, because the central government has taken over a lot of the decisions during the crisis, and that has created a lot of resistance. But at the same time, it has shown some of the dysfunctionalities of federal and decentralized systems.
Thank you. I think the time has come to move back to the second half of the panel. And we'll start with Elias Naumann, who's going to speak about Germany.
Yeah, great. Hi, everyone. My name is Elias Naumann, Kennedy Fellow at the Center for Studies and a postdoc at the University of Mannheim in Germany. So, Michael, can we switch to the slides, please?
Michael, the slides.
Michael, the slides. The slides. Yeah. Okay. Thanks. And then we start with the next slide. Here you see the policy measures, the most important ones in Germany, and I will only very briefly summarize these because I think they resemble much what we have seen in countries, in particular, what we've talked about Switzerland, that their first cases and information were already in January, and then it took some time when not much was happening, because it was about around mid-March when the first measures were introduced, and then it went very quickly from cancellation of big events with more than 1,000 people to the complete lockdown with a restriction of democratic rights, and that you were allowed to meet with other people outside of your home, and stay-at-home orders, and the closure of all non-essential businesses. And in Germany also, we have then some policies that were intended to buffer these consequences, like an extra budget of 150 billion euro and the short time work where people work, this some kind of form of government subsidized work so that people are not laid off. This lockdown then lasts for about a month, and then like end of April, there was a slow reopening of the country and the economy. And what I'm interested in here, because this very much resembles what we know, is the social and political consequences. Can we move to the next slide, please? And here we rely, or I rely on results from a survey that we started with colleagues in Mannheim. And this started, as you can see, in the shaded area here, in around the peak of the crisis. That started with daily surveys on March 20, and a sample of a mobility sample of the German population, and have a variety of topics on work and employment, childcare, mental health, the acceptance of policies, and also COVID-related behavior risks and perceptions. And I would like to focus on two of these results. So to the next slide. The first one is much related to the policies we've just heard about, is the acceptance and support of these measures. And here we see that in the beginning, when we started the survey at the end of March, there was a tremendous support for closing public facilities, for closing the borders, and for also ban these large events. So more than 90% of the population supported these measures at the beginning, but also support for the lockdown. We have there we see that the majority of respondents supported these measures. And now if you look how this developed over time, so here's the most up-to-date data, the time we're looking at until so Wednesday this week. And we see here's that there's that the support goes down, and like for closing public facilities, it goes below 50%, and also support for the general lockdown goes down from 50% to around 10 to 20% of the population. And the other, I think, important thing are the social consequences. So please go to the next slide. If we look at the employment situation of people here, you see how respondents that have worked in January, that were employed in January 2020, that is before the COVID crisis started, how they are working now, and whether they are working at workplace, whether they are working in home office, or whether they are on short work or laid off. And I've split up this for different income groups to see whether people are equally or unequally affected by the crisis. And what we see here is that it is indeed very unequally divided, and it goes along the existing social inequalities. So those with a high income, the high socioeconomic status people, they are able and could work from at home, and also the risk to become unemployed is much lower. And in contrast, if we look at those with a low income below 1,000 euro, there are two types of risks here. The one is that they have to work, which puts them at a high risk to be infected. That's one risk they face. Or the other one is that they are losing their job or lose large shares of income when they are sent to short-time work. Whereas only very, very little share of them can work from at home in the home office.
Okay, time is up.
Okay, yeah.
Thank you. Next speaker is Päivi Neuvonen, who will speak about Finland.
Yes, hello, my name is Päivi Neuvonen, and I'm a postdoctoral researcher at the University of Helsinki and also a visiting scholar at the CES. And Finland has a population of 5.5 million, and we currently have 6,200 cases, and more than 70% of these cases, reported cases, are in the Uusimaa region, which is where Helsinki is also located. And in terms of different policy responses, we still have two types of measures in use. Those adopted by using emergency powers, and then those adopted through ordinary legislation. And as many other countries, Finland is currently moving from protective and restrictive emergency measures to policies that try to address the more long-term systemic and economic effects of the epidemic. And in Finland, this has created some uncertainty about what the government's strategy actually is, and does this mean that Finland is moving closer to Sweden's strategy? And transparency is very important in the Nordic countries, especially transparency of administration, and this can of course be a relative question, but this has been one of the major challenges during this outbreak in Finland. And this also includes Parliament's right to receive necessary and meaningful information from the government under the Constitution. And this is also the first time Finland is in a state of emergency since the Second World War. and the first time the current Emergency Powers Act is used in practice. And the use of these emergency powers is very strictly regulated, and it must also comply with Finland's international human rights obligations. And Finland has no constitutional court. Instead, Parliament's Constitutional Law Committee normally a priori reviews the constitutionality of legislative proposals. And in a state of emergency, Parliament has the power to ex post review the government's emergency decrees. And although most of these decrees, almost all of them have passed this review, in practice, the Constitutional Law Committee has still been quite critical of many of them. And it has emphasized the priority of ordinary legislation over emergency powers, and also the priority of normal limitations on basic rights instead of these emergency exceptions under the Constitution and the Emergency Powers Act. And this same committee, it will also review the constitutionality of Finland's participation in the EU's planned recovery measures. And in the past, it has emphasized that Finland's responsibilities must not risk its constitutional duties, including the protection of socio-economic rights. And I think that this is quite important or potentially important for the future. And very briefly about the economic policy response. So Finland started with the principle of the smallest possible intervention, meaning that the focus was very much on different business development measures and state guarantees. But it soon became obvious that more direct crisis support is also needed. And at the moment, we have a three-step approach in use, which means that direct crisis support is granted during the spring. Then recovery measures are adopted from the summer onwards, and then very strict austerity measures are planned from 2023 onwards. And of course, Finland is very dependent on export, and that means that in reality, the economic effects of the epidemic might not be fully visible yet. So there are a lot of open questions in terms of the future policy in Finland.
Thank you very much. The next speaker is Barry Culfer, who will talk about Ireland and the UK.
Thanks so much, Art. Michael, I don't need the slides until the very end, so there's no rush. Thanks all. It's a great pleasure to be together with colleagues, and thanks to everyone for joining in such numbers. I'll briefly summarize and compare these two cases, which is somewhat ambitious in 3 minutes. But as I have 3 minutes, I'll finish with 3 things to take home about COVID-19 in Ireland and the UK. So to visit Ireland first. Ireland went into lockdown relatively early on the 12th of March and is currently undergoing a period of lifting of these measures. This is a temporary government in Ireland following inconclusive elections in February, and support for the government has been high throughout the crisis. The measures are broadly similar to those implemented in the rest of Europe, but socially, one important area for the future of the country that I'll mention that is interesting is that the private healthcare system has been brought into public management, at least for the duration of the crisis. In a country where 45% of the population have health insurance, this is notable and might be hard to unravel if the crisis ends. To move swiftly to the UK, after a slow response initially with plans for herd immunity, which has been widely documented, the UK started introducing its restrictions on the 20th of March and quickly became a world leader in cases, sadly. I'll just focus on one area of interest for politics in the UK. The responses in the different parts of the UK. Remember, the UK is 4 nations, has 4 nations with devolved powers in certain areas, including with respect to public health. These nations are now operating under different lockdown regimes. There's just a helicopter going by the window, forgive me. These differences can't be explained purely in terms of epidemiological conditions, given that the trajectories of the virus in Scotland, Wales, and Northern Ireland has been broadly similar to those in England. The reality is that the leaders of the devolved governments have reached different political judgments from Prime Minister Johnson on when to relax or modify restrictions. and this piles further pressure on the already imperiled union. If it's ready, Michael, I might have my first slide. It's not crucial. To do a crude comparison between the two countries, we know it's really hard to compare countries when it comes to COVID, but the UK and Ireland are as close as two countries can be. So, thank you. To put it rather bluntly, a higher proportion of the Irish population has contracted the virus compared to the UK, albeit rather marginal. But a noticeably smaller percentage of those infected in Ireland have died. So it's 14% versus 6% in the UK. 14% in the UK versus 6% in Ireland, rather. Ireland has a younger population centres are less dense, but that's not enough to explain variation. And this feeds into a wider debate, which brings me to my three take-homes and my conclusion. Firstly, claims that the pandemic promotes the case for Irish unity are commonplace. Having initially diverged, the Republic of Ireland and Northern Ireland are now essentially walking in step with an increasing degree of all-Ireland cooperation, with the signing of a memorandum of understanding between the two jurisdictions in April. The apparently more effective response of the Irish government has become important in the political debate in Northern Ireland. Let's take my second slide, please, Mike. And the sheer practicalities of having two jurisdictions on one small island, when it comes to public health at least, has been widely questioned. Secondly, and penultimately, in terms of how the two governments have communicated and justified their decisions, while briefings in Ireland are delivered by medical experts and in the UK by senior politicians, the increasing role of SAGE in the UK, that's the Scientific Advisory Group for Emergencies, might be showing a rebound of experts in the UK following years of backsliding, which kind of echoes a bit with what Monica was saying in her presentation. And to conclude, we must of course not forget about Brexit. There's been precious little progress made on this front during this key period. Some figures within Westminster have identified hard Brexiteers preparing to use COVID as political cover to justify a no deal. The UK has until July to seek an extension, and a no deal by December is now highly and increasingly possible. This would have major implications for everyone in both countries. Thanks.
Okay, thank you very much. The next speaker is Ruxandra Paul, who will talk about Romania.
Hello, everybody. My name is Ruxandra Paul. I'm an assistant professor of political science at Amherst College in Massachusetts and a visiting scholar at the Center for European Studies. I will tell you two stories during my presentation today. The first one concerns migration. It's impossible to tell the story of how COVID-19 evolved in Romania without mentioning migration and specifically freedom of movement in Europe. So I will tell you a story about Europe's essential workers and transnational exchanges and specifically migration from Central and Eastern Europe to Western Europe. A story that is important because it shows the dependence of European economy on freedom of movement. And it highlights the way in which we would not be able to talk right now about economic reopening in Europe. We would be tackling massive food crises and deficit of care crises without these essential workers. And the second story that I will tell you is about national lockdowns and, believe it or not, pigs in mating season and political strife and polarization. So the first story, there are before the coronavirus pandemic, there were anywhere between 3 and 5 million Romanians who were working abroad in Western Europe, in Southern Europe, using European citizenship in order to pursue opportunities for employment abroad. These, when the coronavirus epidemic hit in Italy and Spain and other countries where these Romanian workers had their jobs, these countries' lockdowns ended up basically trapping Romanian workers in very difficult conditions. Some of them were trapped on farms and not able to return to their countries. Others were just plainly kicked out of these countries and told to go home for the duration of the pandemic. And so there was a wave of workers, Romanian workers who came back to Romania in February and March. The first case, case zero, patient zero in Romania, was actually an Italian businessman who had traveled to Romania in several locations. So the start of the coronavirus pandemic was related to these transnational connections and to the return of around 1.5 million people from countries in Western Europe and Southern Europe. What ended up happening, though, is that come April and May, Western European and Southern European economies realized that there were massive work shortages. And despite rising unemployment in countries like the UK, Italy, Spain, the citizens of these countries were not willing to go for these jobs, for jobs in agriculture, in caretaking. So there was a possibility of, thank you, there was a possibility of food shortages, caretaking issues, which ended up forcing these governments to go ahead and call these workers back. So currently, there are charter flights that are arranged, despite the fact that nobody else in Europe is moving. These Central and Eastern European and specifically Romanian workers have been called back and are flying back into Italy, into the UK, into Austria and Germany to prevent crops from rotting in the fields. The second story has to do with political strife and the fines. So Romania tackled the crisis by imposing state of emergency. Now we have moved to a watered down version, a state of alert. But the fines that they were imposing were very, very heavy. And they applied, for example, old people were not allowed, people over 60, 65 were not allowed to leave their homes. So there was this old lady, 83 years old, whose pig had been well, it was mating season, so the pig ran out of the garden. And this old lady ran after her pig to catch it and to bring it back home. What ended up happening was that the police caught her chasing after her pig and fined her the equivalent of $5,000. And the Constitutional Court basically stepped in and for cases like that of the old lady chasing after her pig, to say this is unreasonable. And so there has been a political strife between the Constitutional Court, the president, and the Romanian government. It has been politicized. The Constitutional Court has stepped in to defend fundamental rights and prevent arbitrariness when it came to application of state of emergency rules. So to conclude, I would say that there is a silver lining, and there is a sign that there is resilience in terms of institutions in liberal democracies when state of emergency is being abusively taken advantage of. And there's also resilience in terms of the systems that were in place, established by the European Union. Freedom of movement is absolutely shown as being relevant, essential. Without it, essential workers would not be able to go to Western and Southern Europe and to help alleviate food shortages and caretaker shortages. Thank you.
Thank you. And our final presenter is Antoine Camus, who will speak about the Eurozone.
Thank you, Rad. Good morning, good afternoon to everybody. I'm Antoine Camus. I work at the University of Mannheim. So I thought I would like to share with you some thoughts that I have gathered about the consequences of this health and economic crisis for the financial architecture of the EU and the Eurozone in particular. And these thoughts are essentially related to the management and the sustainability of sovereign debt that's going to increase across all countries in the Eurozone. So debt to GDP ratios are very diverse across the Eurozone, but unfortunately the current health and the economic crisis is going to hit the weaker country the hardest. And that will contribute to increase the heterogeneity of economic situation across the common market, which makes the case for real European solidarity mechanisms even more urgent. So to be fair, the cost of high level of public debt are widely discussed. On the one hand, interest payments may weigh on public finance, but these are at a historical low. And on the and to add to the bright side of the current situation, the current packages of measures that the European Central Bank has deployed ensure market access and for rollover of current debt situation. On the other hand, it seems that the macroeconomic implications of high level of public debt are contributing to depress substantially aggregate demand and to numb economic dynamism. Okay, so that will lead to a situation of diverging economic situation where at fixed level of exchange rate, that's going to reinforce the political and the economic tensions across country in the Eurozone. So if there is a consensus about the need of debt reduction, we need to consider the options, and the options are pretty straightforward. The first option would be to increase taxes, but that is facing some political economic difficulties within countries, but I think more stringently, this is facing the difficulty of the mobility of tax base across European countries. A second option is debt restructuring. This is a nice word to talk about debt default, but this again is a very unattractive option because countries with high level of public debt, their debt is essentially held by domestic residents or by the banking sectors, which are already pretty weak. A third option that people usually mention is monetization. That would be a real substitution of debt for money or inflation, but here again in that case, the ECB has no legitimacy to generate those substantial transfers, and it seems that the necessary conditions for inflation are not there as well. So we are left with a status quo that we observed about the past 10 years, where individual countries are left to handle the legacy of the previous financial crisis of their own, or the deployment of ambitious European financial solidarity. Up to now, the European response has not been really following this ambitious plan, or the talks about grants or the Corona bonds have been ditched. And the current package that the European Commission has managed to implement are effectively insignificant in providing relief and transfers to individual countries. So in this environment, we can look at the institutional setup, and this looks pretty worrying, right? So we have a European Central Bank that has already opened its gate to support economic activity, but as we mentioned earlier, is highly contested. And we have individual treasuries that also have implemented unprecedented measures to try to support their economies, but they are facing very different economic situations. So in that context, it seems that status quo is a very dangerous and very fragile situation that could be sensitive to very, very tiny shocks, and that could endanger the whole common goods that we have built over decades, which is the common market and the political projects that the EU has followed over the past decade.
Thank you. Okay, so let me stop the timer. We'll move on to a second round of questions, beginning with one from Tony Sun, who is the Director of Administration and Finance at Harvard College. He asks, as the investigation of the origin of COVID-19 intensifies, how does that affect European public sentiment towards China? And I'll supplement that question by adding the United States into the mix. How have European perceptions of the United States been affected by the crisis? Anyone want to respond to those questions? Anyone from the first panel? Okay, well, I'll move on to.
Well, I mean, if I may, Art.
Yes,
Um,
Roxy.
So I think that the question is complicated by the fact that in Eastern Europe, the coronavirus was not associated publicly with and primarily with the strands of virus that came from China. In many cases, it was a question of intra-European Union mobility. So as I mentioned in my presentation, the first cases were people who had traveled within the borders of the European Union. In many cases, it was something that had to do with questions of public sentiment concerning the countries of origin of patient zero, and then the waves of migration within the European Union as people who were working or studying elsewhere returned to their country of origin. So in Romania, for example, there were questions about the perceptions of the diaspora coming back home, repatriating from countries like Italy, like France, like Germany, like Austria. And so there was initially a sign that political tensions were amplifying, that people were blaming the diaspora and people who had used freedom of movement for the rise in the number of cases, and that was correct. In the initial phases, you had 49% of cases connected, so not just through local transmission, but from the people who were returning home. But the measures that the Romanian government took, which were quite aggressive, including the border controls, including mandatory quarantines, in some cases institutionalized quarantines, so people would be taken from the border and placed into hotel rooms where they would be tested. So there was mass testing going on as well. And then they would have to wait there for 14 days before actually going home. All of this ended up being very successful. So ultimately, ICU capability were not overwhelmed in Romania. There were relatively, compared to the numbers, when you're thinking about 1.5 million people coming back from other places in Europe and facing this outrage, because the non-movers were saying, oh, the diaspora and the people returning are going to infect us. This was alleviated by the fact that there were only, overall there were only 16,000 cases and only 1,000 cases of death. And so because of the measures applied under state of emergency, so the state of emergency lasted for 2 months since March 16th. Right now, we have just transitioned, in Romania has just transitioned to state of alert yesterday. So all of these measures had the effect to diminish the pushback against people who are returning from their countries of employment.
So what do you think the longer run consequences will be? Will there be permanent changes in the European border control?
Well, I think what we have seen is that even in the case of state of emergency and border limitations being imposed across Europe, that it's impossible to abandon free movement, that it has to be allowed. So despite the fact that all countries imposed restrictions and closed their border and prohibited flights from circulating, prohibited train transportation, bus transportation, it was absolutely impossible to maintain these without creating exceptions for people like essential workers, people who were dismissed, who had been dismissed before as, just temporary seasonal workers in agriculture and caretaking. Well, it turned out that the citizens of the receiving countries were not willing to take those jobs that had emerged in these economic sectors. And it was absolutely necessary for the governments of countries in Western Europe and Southern Europe to negotiate, to essentially, you know, beg countries in Central and Eastern Europe to send their workers back. So they, even at the peak of the coronavirus pandemic, there was the need to create a special system of chartered flights, trains, buses, to institutionalize the maintenance, the return of these workers from Eastern Europe, where they had been sent by the countries where they used to work, returned back to the countries that needed them, countries that were facing profound shortages of workforce in agriculture and in caretaking. And if you think about it, if someone has to take care of vulnerable people at home, like children, like elderly, like people with disabilities, and they cannot rely on caretaker migrant workers, they're not going to be able to go back to their job. They're not going to be able to hold their job. So it would be impossible to reopen the economies in Western Europe without them.
Thank you.
If I may go back to your original question about China and the US.
Yeah.
So, I mean, I think in the case of China, clearly the perception that they have is that the perceived weak response on the part of the West, both Europe and the US, and the bad performance of the West during this crisis is a confirmation of the decay of the West. So they see this as an opening, an opportunity for China to emerge as the leading power. And they are becoming much more assertive. And I think we have been seeing manifestations of that. The dispute, for example, over the document that was prepared by the European Commission about China's activities, and they were very forceful trying to tone it down and not to be perceived in such negative light. So that's just one example of how strongly they're trying to clamp down to come up in a positive light, despite the fact that the crisis started in that country. In the case of the US, I mean, I think in some ways it's not a surprise, but the lack of leadership of the US during the crisis, this has been a reaffirmation of that lack of leadership. And if anything, there is even more disappointment because some of the actions from the US, starting with the fact that they didn't contribute to the global initiative to contribute to a vaccine, and also other examples in which they have tried to prioritize European companies to give vaccines to the US. So all those actions have been perceived as just a confirmation of the America First approach and a continuing deterioration in the partnership and in the leadership role that the US has been playing.
Okay, let me move on to a second set of questions, which will broaden out this discussion of changes in the European Union. The first is from Hartmut Lentz of Harvard, who asks, will the current European response to the COVID-19 crisis further erode the European integration process, or rather highlight the necessity for a common response? Wojciech Wajnacek of Harvard Business School asks, how do you assess the chances for EU bonds to support more fragile European countries such as Italy, Spain, Portugal, and so on? And finally, Varia Hussain, local councillor for the Labour Party in Luton, UK, asked whether Europe has a role to play in the UK's post-COVID economic recovery. So I'll turn back to the panel.
So maybe I can quickly restate what I said in 3 minutes. My individual perception of the situation is that the current divergence of economic situation is calling urgently for a deepening of European mechanism, solidarity mechanism, but that unfortunately what we observe is that individual participation constraints are very tight right now, and that the appetite of the countries that weather that crisis fairly well to step in and help those countries that have been hit harder by these countries is extremely low. And that's where most of the risk for the integrity of the common market and of the Eurozone lie right now. And there is an urgent need to have an open discussions about what transfers mean and how we can design transfers to make sure that we design a resilient common market. Otherwise, the risk be that we lose that common market and that we lose the whole European project. That's would be my take on this.
Thank you. Anyone else?
If I may intervene, Art.
Yes.
Thanks all. So I think with respect to, was it Hartmut Mainz's question, with respect to the EU, I think at the very least, the COVID crisis has exposed the limits of the EU's capacity in a bunch of areas where it hasn't got covered, which shouldn't come as any surprise. So between public health and borders, and on top of the weaknesses in the Eurozone that Antoine just set out, I think if nothing else, it's going to really expose these limitations and kind of encourage discussion about it. And I think even before COVID, it was pretty clear that the EU was heading towards a reckoning with respect to some of these cracks. And I would still, it's kind of my nature to be thus, I would still be optimistic that I think this kind of crisis is actually going to focus minds and attention and identify these things that the EU can and can't do. I'll just very briefly remark on Councillor Germer's the question about the UK. I'm sorry, I couldn't remember the councillor's question, as you noticed. But I think that I mentioned at the end of my presentation about how Brexit hasn't gone away. And I think, if nothing else, this whole period has also shone a light on the fact that the UK and the rest of the continent is just intrinsically linked. You know, discussions about buying and selling protective equipment and freedom of travel between different places and different rules for people coming from France and Ireland compared to elsewhere. If nothing else, just shows that it will be impossible to envisage a future for the UK that doesn't involve really close cooperation with the EU. And that's why what I said about the kind of incomplete nature of the discussions going on about Brexit should be real cause for alarm.
Okay, anyone else?
If I may, Art, I mean, just very quickly following up. I think in 2008, we got away with it because of the actions of the European Central Bank. If that had not been the case, probably it would have been catastrophic for the European Union. And in this crisis, the actions of the European Central Bank are not going to be enough because of the depth of the crisis. So we're going to need a fiscal response. So I think the future of the European Union is very much at stake. And one will hope that the European leaders will rise to the occasion and do what is necessary to address this crisis. I think, I mean, if we look at history, I think there are reasons for hope. When we think about some of the most significant economic and social developments in the last century, like the New Deal, for example, it was conceived in the midst of the Great Depression. And the Beveridge Report, which was the prime text of the British welfare system, was published while bombs were falling down in London. So I hope that we have, with those examples, the European leaders, again, will rise to the occasion and do what needs to be done now.
Thank you. So I think this would be a good point to bring in Hartmut Mayl, who is the director of the Center for European Studies at Oxford, who has been standing by listening to this discussion and I think may have a few words to say by way of information.
Art, regrettably, if I just may chime in, I've been corresponding with Hartmut and he unfortunately has been having limitations with his internet to gain access to the Zoom meeting. So he's only heard portions of the presentations. So unfortunately, he has to decline the invitation. It allows us time for another question or for a sum up or something like that. Thanks, Art.
Let me turn to a question that came in during the discussion from Andreas Busch, former visiting scholar at CES, who asks, given the variation in COVID-19 responses across Europe, if one were to follow the Przeworski-Thun research program of replacing country names by variables, what variables would you point to explain the variation across Europe? You know, we have some methodologists in the group, so surely there's somebody who'd like to take this on.
In terms of compliance by the population, I think it's trust in government. That would be my guess. As for the actual choice of measures, I don't know, but But in terms of compliance, my variable is trust in government.
Okay.
Can I intervene for a moment?
Yes, please.
Okay, so my variables that I would substitute certain country names for would be primarily domestic party politics, and how the domestic developments in any of these countries are playing out at the moment may dictate how countries respond long term to the crisis. Meaning not just the immediate health crisis, but also the implications following. So the party politics, whenever we see the party in government exercise full authority and we see a weak opposition or a voiceless opposition, then I would argue that would have an impact on how politics develop from now on. Another one would be the strength of civil society. At this point in time, in a number of countries, particularly in Eastern Europe, we are seeing a lot of action by civil societies who recognize the threat that this moment presents. Meaning, if the government consolidates power, and if the opposition continues getting weaker, then we see a slide towards an inclination towards backsliding, authoritarian backsliding. And if that is a risk, then the strength of the civil society matters quite a bit. And finally, economic indicators and economic interests. A lot of these countries are losing remittances from constrained borders. They are because unemployment is high, and migrants are returning home, and therefore the resources are not coming in. So whatever the economic interests of these countries are also going to dictate a lot what they do in terms of whether or not they open their borders, whether or not they go forward with the green bridges policies that are being proposed across Europe right now. So I think that also plays a role. Those would be my three variables of choice.
And just really briefly, Art, if I may, just literally in 10 seconds, I'm just thinking, listening to Albana and others talking, I think just simply the degree of consolidation of a democracy is going to be really interesting to look at once we look back over how and when measures were introduced and how they were justified. So whether expectations were met in terms of how consolidated a democracy was versus others that are less consolidated. Just an idea.
I'm surprised that none of you has mentioned more technical variables such as the availability of masks, availability of testing, and the date of onset, first onset of the disease. The fact that it came to Italy first and the severity of the Italian crisis served as an example to others, I think is a relevant variable.
This is what I would call luck as a variable as well.
Yes, luck, one could attribute that to luck, yes. So perhaps on that note, we should end. We're coming to the end of our time, unless anyone has anything urgent to say. I want to thank all 10 panelists for their participation. And I want to thank Barry again for organizing this and providing the spirit necessary to get us all moving again.